Hello everyone, welcome to the new episode. Today's host is called Sarah, Spring Pharmacy. Today I want to talk about acne, which most people know as pimples. Acne are caused when the pores are blocked or clogged by the bacteria, the oil or sebum, and the dead skin. The bacteria that causes this acne is called Propionibacterium acne. Also the androgen. Yes, androgen as a hormone also causes acne. How acne or pimples comes on our skin is when the androgen levels are increased in the blood when triggered from the brain, and increase in the levels of the androgen causes more production of the oil or sebum, which fills up the cell. Yes, the cell in the skin, and because the cells are filled up, they tend to break out. Yes, they tend to break out, giving an ample environment for the growth of the bacteria. And when this bacteria grows, it swells and comes on the skin as pimples. Well, we have the risk factors, the factors that can trigger all this. One of them is age, mostly between 18 to 30 years. Because of the high hormonal levels, they're always prone to acne. Also the genetics, yes. This is when you have the history, the family history of acne, yeah, whereby you find that your forefathers also suffered from acne or the pimples. You're most likely to also be one of the culprits. We have stress and anxiety. The stress, when one is stressed or when one is anxious, it triggers, yes, it triggers the sebaceous glands to release more oil or more sebum. And because of more oil and sebum, it will give that ambient environment for the bacteria to grow. That's how the acne comes about. Also, the menstrual cycle, due to high levels of androgen, our menstrual cycle it increases on the androgen levels in the blood. And as I said before, that increase in androgen levels increases on the sebum production, fostering the growth of the bacteria. Also, some medications like corticosteroids. Yes, the corticosteroids triggers the cortisol. Yeah. Now, when the cortisol is triggered, it will stimulate the sebaceous gland to produce more sebum. The sebum gives a good environment for the bacterial growth, still leading us to the acne. Lastly, the jellies, the Movit, the Baby Junior, all the jellies. When you use them on your skin, they block the pores. When the pores are blocked, the acne is always produced. The treatment, yes. All the products that you can use to clear the acne, if you already have it, yeah. We have varieties depending. The treatment depends on the severity of the acne and the type of the skin that you have. But before I talk about the treatment, let me talk about the forms of acne. We have the blackheads, which are also called the open comedones. Then the whiteheads, which are also called the closed comedones. Comedones are clogged or blocked skin pores or hair follicles. Yeah. So when the blackheads, let me start with the whiteheads. A whitehead comes when the pores are completely closed. Yeah, they're completely closed, forming a lump. Yes, a lump under the skin. It forms that small flesh-like lump under the skin. Yes, on top of the skin you will see it whitish, and it is always around here and the nose. Yes. Then the blackheads. Blackheads, I said, they are open comedones. Open comedones, that means the pores are slightly opened, and because it's opened, it enables the air from the environment to oxidize the sebum and the melanin on the skin. And after oxidizing those two, they become dark. Yes, they become dark, and that's how the blackhead comes. Yes, it appears on the skin, mostly around the forehead. There are always dark spots, like the dark pimples. Yeah, that's how the blackhead comes. Back to the treatments. Our treatment covers both the forms of the acne. The first one is resorcinol. Resorcinol breaks down. Yeah, they break down this. It breaks down the whiteheads and the blackheads on the skin, clearing all the acne, making your skin remain clear. Yeah. Then the next one is salicylic acid. The salicylic acid, for it also breaks the whiteheads and the blackheads. Yes. Also, it reduces on the inflammation on the skin. The next treatment is benzoyl peroxide. The benzoyl peroxide, for it, how it works, one, it kills the bacteria that has caused the acne, the Propionibacterium acne. It kills it. It also accelerates. Yes, it accelerates the skin replacements. Yes, it also does that. Then it also reduces on the sebum production. By reducing on the sebum production, it will be killing the bacteria. Then another treatment is azelaic acid. Azelaic acid, for it does about 3 things. The first is strengthening the cell walls. That means by strengthening the cell wall, it will stop the release or the breakdown of the sebum or the oil that has already been formed. Yes, that means the bacteria will not be able to grow. Then it also stops the production, the sebum production, or the oil production on the skin. Then we have the retinol. Retinol, for it works on acne by increasing on the cell turnover. When the cell turnover is high, then your skin is most likely to be clear without acne. Yeah. Now, all this, we shall say that for people with sensitive skin, yeah, for people with sensitive skin, all these products, they can best use them in creams and lotions. Yeah. Then, for someone with oily skin, oily skin, it will be best for them to use the oil-based gels. Like now, the benzoyl peroxide, you can use it on your oily skin and your skin will remain dry. I mean, because of how they work, your skin will just remain okay without overproduction of the sebum on your skin that makes your skin too oily. Thank you so much for listening. Spring Pharmacy, we got you covered with hard to find medicines. Besides that, your skin, how you look, is our number one priority as well. Thank you so much for listening to me.